today we have Alexandra Canzonieri.
You got it. Yeah.
Is that all right?
Yep.
On the show from GreenPath, and she's an accredited psychotherapist,
That's it.
and we're welcoming her on the show to talk about things like all those kind of like acronyms we use, like CBT and EMDR and all that stuff. So we're going to get into that today. And I'm also, I must add, in it for the free therapy.
It's- this will be your free session. You get one
Yeah,
free session. Yeah.
that's right. That's right. Yeah, I just realized that the other day. I was like, I've been doing this for about a year and a half now, and I'm like, this is free therapy for me, even if I have like a pro basketball player on the show.
Nice. Okay.
Yeah, it's all therapy.
Yeah, I guess so. Yeah, it's healing for everyone. Mm.
So, can you, Alex, is that okay? Could I call you
Yes.
Alex?
Yes.
Okay. And Canzonieri is the right pronunciation?
Yeah, you did really well with that. That was
Nice.
amazing. Yeah.
Perfect. All right. So tell me about GreenPath.
Sure. So GreenPath is a clinic that I started about a year and a half ago. Now, before then, I was working in private practice and I've always been very trauma focused. So I wanted to create this very kind of trauma focused collaborative culture where other clinicians who are also highly experienced in treating trauma, we would all come together, we would work on cases together, also having a very kind of like systemic approach, meaning that we like to incorporate different systems. When we're working with teens, we want the family involved, we want to know about the school, we want to know about the hospitals they've been at. And so really kind of taking on that holistic approach. So we are a trauma specialized clinic. um, that being said, though, I think the word trauma can feel a little bit intimidating for some people. They're like, well, I don't have trauma. I think they think of like PTSD and these very kind of like significant, symptoms that, they would think that the war veterans had. That's not necessarily it. Sometimes we get clients that they'll come in with a symptom and they'll just be like, oh, my like jaw's really been hurting. My dentist, they took a look. There's nothing physical there. It's probably anxiety. Well, we could start with the symptom of anxiety, but then, doing a little bit of digging, we realize, hey, there's some underlying trauma. So that's what GreenPath is all about. We keep our door open to anyone who might be experiencing, they think they might be experiencing trauma or they know they have trauma.
Wow. Okay. So yeah, trauma is kind of a buzzword we have these days as well. Like we seem to be jumping in the pool with both feet at the same time.
Yeah.
And you're right. Like trauma for some people can be a skin knee, and then we can go to like a first responder who witnesses something terrible on their shift.
Yeah.
Or it's across the board actually. Like and we have to react the same way to the skin knee as opposed to what you see on the what a first responder might see. So when did trauma work become a calling instead of a job?
Yeah, I think it's actually the pull for me to even go into psychotherapy. Like from the get-go, when I was doing my thesis back in graduate school, it was all about trauma. So it was an interesting kind of niche thesis. I focused on women survivors of childhood sexual abuse who were in their second trimester of pregnancy. But we
Wow, okay, that's a lot to unpack there. That
it is.
that
It is. But it's not even finished because oftentimes society, we look at like PTSD. We always look at trauma from this very kind of like deficit, negative lens, which obviously there are all these symptoms to it, and there is that part of it too. There's also this other part called post-traumatic growth. And so what me and my supervisor wanted to see was how pregnancy can facilitate post-traumatic growth in people who had experienced childhood trauma.
Yes, the joy of bringing new life into the world.
Yes, yeah, and it's like a fundamental, very transformative experience, and not just for, as we kind of move into like a whole new identity, but also there's all these kind of facets of post-traumatic growth, but it could be like a change in perspective, changes in the relationships in our life. How do we, now define meaning? So there are a lot of different parts to it, which was actually really kind of inspiring.
Absolutely. And so yeah, in this on the same aspect, what does trauma look like in the everyday of it all at Green Path?
Yeah. So oftentimes, okay, so sometimes we get people that are like, I have those more kind of classic PTSD symptoms of like I've been getting the like flashbacks or the nightmares of this one event. It keeps coming up for me, and they know exactly what the event was. For other people, it shows up maybe more so as like chronic anxiety, or they notice there's a lot of anger that they're holding on to. It comes out in their relationships. They notice a lot of conflict arising in their relationship. They'll be like, my partner, when they say this, when they do this, it just really activates me. And so they actually don't know what's going on there. And that takes some work because we want to manage what's going on right now in the day to day because that's the most relevant to the person. But through time, we can also look at, okay, what is this connected to? What is this feeling you're experiencing now feel like for you? Is it familiar? Where can you go back to? And once we kind of establish, an idea of where it came from, then we can move into maybe more trauma specific treatments such as EMDR. But we have to be very specific about the target memory that we're going to be using in something like EMDR.
Well, that's an amazing one that I'm going to write that down. Target memory.
Yeah.
Yeah, I have a lot of hot thoughts. So, but like both good and bad. But like my hot thoughts are the ones I kind of run away from when trauma sneaks into my mind. And
Right.
I'm wondering, like, I just wrote an article for the Globe and Mail called "Mental Illness is Private Until It Isn't." So, like, what are signs of people with trauma, like in the everyday world, like where like it's very it can be very noisy, but it can also be very quiet. So, what are some quiet symptoms of trauma that people can't generally see on the surface?
Yeah. So oftentimes, people will internalize certain symptoms, and those can be like the quiet ones. Um, Anything that'll activate the nervous system or overwhelm the nervous system, it doesn't necessarily mean it's going to look like, fight or flight, panic attacks, those very kind of like overt symptoms. Sometimes they're more like my nervous system is completely shut down. And so it can look like, a difficulty saying no to people, being very passive, difficulty in setting boundaries. And this is more kind of relational. It can be like dissociating, so really hard to focus on things that they need to focus on. Sometimes it's even just the kind of physiological symptoms of anxiety as well. How does that show up? It could be stomach pains. A lot of people have that I work with, especially people with anxiety, have digestive issues. We know that's all connected. It could be more chronic pain, constant headache.
Toothaches,
What's that?
toothaches.
Maybe toothache. Are you getting toothaches?
No, no, no.
Okay.
No, you had mentioned it earlier that somebody had
Yes,
something
it could be jaw pain. So,
jaw pain.
let's say like at nighttime when you have that kind of like locked jaw, people aren't even aware of that until they start to feel the pain and they go to the dentist and they're like, "Oh, you're like, you're what's it called when you're like you're like chewing in your sleep." And so,
Bruxism.
what's that?
Bruxism is your grinding your teeth in your sleep.
Grinding your teeth. Exactly.
Yeah.
Yes. Yes. Yeah. So that's a symptom. There could be other things, but once they kind of get the clear from like a doctor or a dentist, and it's nothing physical, then they start to look at something more psychological, and then people might be referred to, let's say, a psychotherapist or a mental health professional to figure out what that could be.
I heard a quote recently. It was like somebody from where I used to work was that I used to hang out with like actual criminals and doing actual I was a good person hanging out with actual criminals and I didn't get anxiety, but now I get anxiety just when I go to the Walmart.
Oh, okay.
That was
Which,
her quote. Yeah, I was like, you can go that far on the spectrum from involving yourself with real life criminals but now you get anxiety just from going to Walmart.
isn't that interesting how
I
anxiety
thought it
can.
was funny.
Yeah, well, it's the irrational part of the brain, right? That's also very trauma connected. It's like some people are so used to living in danger, and that's a familiarity for them, so that can feel comfortable. But
Living in danger. That's another one I have to write. You're making me write everything down
that's
today.
great. Yeah, yeah. Living with danger feels safe, but then have agoraphobia. Going outside and meeting new people can feel absolutely terrifying.
There you go. You've sourced it. So in Alex, if therapy was a toolbox, what tool do you most often use in treating? Well, we're still on the trauma topic. Well, let's dive right into trauma. What tool would you mostly use to treat somebody who can't function?
Yeah, we got to meet people where they're at, and so sometimes we're not going straight into trauma reprocessing. We need to assess a person's stability. So, if they're finding it, they're living paycheck to paycheck, maybe they get ODSP or something and they're barely making, ends meet. And then, they're a single parent, like the things just kind of add on and on. We have to focus more on stabilization. We are not going into trauma processing at that point. And that's why before we even bring in something like EMDR, we need to make sure that that person is in a secure place. And so stabilization will look like teaching more so grounding strategies. So things to get people back into the here and now. So it could be, someone's constantly getting dissociated. Okay, we need to do, the 5 4 3 2 1 technique. We need to do way more breathing techniques. You need to learn to be back in your body first before we can even think about entering or reopening a wound.
He's just going to bring up breath work. And what are some, other than this like traditionally, like you start at the beginning, or you find that target memory, what are some what are some calming tools you would use to for a patient's nervous system? What, like breathing, yoga, meditation? Where would you start with?
It could be. It also depends on how comfortable a person is with any kind of touch and movement as well, because even that could be traumatic for a person. So there's something that I've been getting into recently. It's called super resourcing. And this is more
Super
so
resourcing.
super resourcing, which is honing into maybe more positive figures in a person's life. So instead of going straight to, okay, what was negative? Let's process that. It could be like, let's go back, or maybe a person just is going back to a time that feels very distressing for them. And super resourcing is, okay, can you think of a nurturing figure in your life or a protective figure in your life? Maybe even if they weren't real, can it be an imagined figure? And so that way people can start to kind of create this figure of strength. And that can really help them through, let's say, go like if they are dissociating or going through, or they're getting triggered. Uh, and I think just knowing that they have that kind of support from someone, again, it can be like an imaginary figure, but that could be so powerful for them. So if they go back to a place, it's like, okay, do we need to ask our nurturing figure to come here? What is that nurturing figure going to do for us right now? And so that does involve some breath work, that does involve some imagination, some visualization. So that could be an example of some kind of grounding strategy we would start with.
It is a good strategy. I often use archetypes as coping mechanisms.
Oh, that's cool. What kind of archetypes come up for you?
Um, Superman, really,
Nice.
or a comic book character of some kind.
Yeah,
And I don't let it like take me away. I just like I resort to something fictitious to cope with my real life.
that's great.
And yeah, it's just it can get out of hand, but I mean it's like, yeah, I can't fly. I don't have heat vision. I don't have cold breath. I can't see through walls. But using that kind of archetype, I sometimes gain a little bit of extra strength from just thinking that I'm bigger than myself. And I know it's not true, but it's something that can take you quite far. Or just attaching yourself to something like a song or a movie or a book and believing that that realm or whatever that story is part of your own life. And that's, I guess, where things get even like where things can be popular for people is, what do they watch? What do they listen to? What do they read? Can they direct their site or their mission to something playful that can help them cope on the day-to-day basis?
Yeah, totally. I think when we're attracted to that, whether that's kind of like fantasy, superpower, there's something really powerful about that, right? It's like,
I think that's why it's so popular too,
right,
because people can relate, they try to relate to it, right?
right, yeah. Yeah, and like you said, thinking about something bigger than the self, that can be such a powerful tool. That's actually a big one too. When I used to work in the area of addiction, it was always thinking about what's beyond what you're focused on right now. And a lot of it, I know AA kind of philosophy is, volunteer, like help people, like really kind of think about something else or someone else's problem, and it just minimizes yours.
Absolutely. Like something outside of yourself. It doesn't have to be like real, but the reality of it is that it can help it can help guide your life in a positive way.
Absolutely. Yeah.
being an extreme overthinker, what advice would you give to people that overthink even the smallest things, as opposed to like, let's get into like you did discuss breath work, but what type of overthinking coping mechanisms can you give us today?
I think overthinking. So, one thing I also want to say too, with any kind of symptom, we never want to pathologize it in the sense
Yeah.
that it's kind of like, we're villainizing that part because there's a reason we have that. Even overthinking, that could have been a protective mechanism. That is a survival mechanism. What does the overthinking do? So before we even think about coping, which I think could imply almost like trying to turn that off or telling that part, hey, we don't need you, it's not good, it's understanding where that part is coming from. When we're overthinking a lot, it sounds like it's a loud part that wants to be known. What is its function? And so before we can get to that place of trying to quiet it, we need to know, hey, why are you speaking so loudly right now? Let's understand that piece. Let's get curious with the overthinking, because maybe that overthinking is giving you some kind of wisdom or insight that we're not thinking about because we're like, it's just so distressing, I just want this symptom to go away. But let's look a little closer and maybe learn to develop a sense of compassion towards that part. And maybe then it'll start to naturally quiet down once it actually feels heard and seen. If we're looking for like kind of hands-on strategies when it's like this is just too debilitating, the other piece of overthinking is it's very futuristic, right? It's either futuristic or
Ah,
ruminating. And so that implies too we're not living in the present moment. So it's really kind of going back to those grounding strategies. What do we need to do in the here and now? Overthinking is very cerebral, so maybe we need to connect to these other senses in our body, right? And so to kind of maybe stop the spiraling, why don't we use like cold water, right? Just put cold water in your wrist, put cold water on your face in that moment.
mindfulness, really, there, like,
Yeah. Yeah.
yeah.
Yeah, it is. It's yeah, learning to we're cultivating mindfulness by learning to be in the here and now. Maybe it's a kind of scent, right? Like our olfactory system is linked to our memories, and so maybe there is a comforting scent that can bring you back to something more positive. The other piece too with overthinking is you can also see it as a bit of a superpower, right? It's not bad that you're thinking about all these different possibilities and preparing the system for that. But anytime we're thinking about maybe something on the more negative end, like all the things that could go wrong, maybe we can hone in on the overthinking and utilize it to think about all the things that could go right. And every time it's like, oh, this catastrophe is going to happen. Well, what about this really positive thing that's going to happen
Yeah.
that we can celebrate as well? That takes more cognitive energy, right? You really have to actively think about doing that. That's not going to come naturally, but all of these things take practice.
Why wouldn't you say best case scenario instead of thinking about the worst case? And what is the best thing that can happen out of this?
Yeah, absolutely. And what's more likely to happen? Oftentimes, these catastrophes have a very low likelihood of actually transpiring.
Yeah, worry. That's my mother was the consummate worrier,
Uh,
the consummate worst case scenario.
yeah,
But I take that with me, and now, as you mentioned, overthinking can be a superpower. How can these overthinkingness, this worry, sorry, this worry, how can that serve us? Is the way I react to my overthinking is, well, what is it trying to tell me? Well, how does it serve me?
yes, yeah, yeah. What is it trying to give you, right? And maybe in that moment, it's like if it's detecting some kind of threat, okay, like what is that potential threat? What do you feel like you need to be prepared for? And maybe it's more so, maybe it's more subtle, right? It's telling you all these bad case scenarios, but maybe there's something there like you have to read between the lines to really get to.
Correct. Um, so let's change gears for now. I was like, I am very interested, Alex, in your theories on, excuse me, on Eastern versus Western theory.
Yeah.
It's like what what ideas towards Eastern, float you away from the traditional Western model of therapy, as opposed to Eastern being more central around the body, the chakra, the spirituality of it all, and Western being more kind of clinical with medications and hospital visits and things like that. What would you add to maybe like help combine these two ideas? And I'm something I'm very interested in for the last long while, probably about 30 years. Been very interested in Eastern, not Eastern versus Western, but Eastern uh, balancing itself with the Western thoughts and why those seem to be at odds these days.
Yeah, totally. This is so fascinating. It's such a good question because the reality is we live in this society. We absorb the messaging around us through socialization by living in this culture. So it's not that we can, we have this luxury of kind of trying to get rid of all this messaging and just kind of be a hermit, meditating on a mountain here, right? I think a piece of it, and I oftentimes hear this, especially with mindfulness, because we've kind of extracted this one, maybe if we want to use it, a technique, and now really kind of like blew it up in Western society as this like ultimate treatment that's been researched, with all these different clinical populations, which isn't necessarily a bad thing. And, we come up with all these treatments like NBSR or, NBCT, again, not bad things, but I think when we make something so clinical, we also lose the bigger picture. Like mindfulness is also something that comes from, Buddhist philosophy, Buddhist theory of the Eightfold Path, which is introducing you to different things that you can do, a path in order to reach, that idea of like nirvana. But there's so much to it and it's so much more complex than, hey, take this one thing. Like, part of that is like, choosing the right livelihood, right? Like it's all these different things that we can do and implement in our life to help us feel better. So I oftentimes say, look at the bigger picture. The other piece too is Western society. We're all about the individual. It's so individualistic, and it's always about, what can I do for myself that really perpetuates that hedonic treadmill, right? That we're never fully satiated, no matter what we're actually achieving, no matter what we're actually doing. And this idea of non-being, which I find quite fascinating in Buddhism, which also I think takes the pressure away from people who are so fixed on this idea of finding an identity. And I hear this a lot with people, like with anxiety. It's like this existential crisis of like, I don't know who I am anymore, or I notice myself, I'm so different from who I used to be, and I just want to go back to that. And the whole concept of non-being is like you're never going to be the same, right? Like who you are right now, in a few moments you're going to be different because you've already acquired, different information, different conversations. You've, inhaled oxygen, your cells are constantly regenerating. So that idea of trying to like go back to who you were, or, I should be more consistent in who I am depending on which social context I'm in, I see that as more like you're putting pressure on yourself to kind of just stay stagnant rather than just grow, and which is naturally already happening. And I've noticed actually a lot of my clients find that a very liberating concept, because then that doesn't feel like, oh yeah, I guess it's okay for me to, be different in this context versus this context, or it's okay for me to change because of this. Right? Even that whole idea of post traumatic growth, it's not about returning to the person you were before the trauma. It's about how do you feel like you're never going to go back to that. How have we grown from that experience, right? How have we gone through this like grueling, painful process of trying to heal from trauma and actually learn from that experience?
Brilliant. I love your theories on Buddhism.
Yeah.
My thing is like, where do you go? Like when you get that feeling of, you just won the Super Bowl. What now?
What now? Yeah.
You know,
Yes, absolutely.
the Buddhist theories are incredible. And yeah, I would consider myself mostly a Buddhist these days. It took me a long time to understand things like Buddha nature and things like not even. It's funny to even think you can understand it, but Buddha nature, the way, the path, Shambhala, Shangri-La, all these kind of definitions floating around that eventually, after a while, you start to get if you and it comes at you in a different way than you would understand another religion as being, Proverbs or whatever. there are some very useful Buddhist tools to use for people in other religions.
Absolutely. Yeah. Yeah. And I think that's the piece. It's not even that whole idea of like attachment, right? I think for any, organized religion, we can become very attached and kind of see that as, this is scripture. I need to follow this. But the way that I guess my relationship with Buddhism is more so what what am I called to? What do I want to understand? How can I bring this into my life? What's relevant for me? How does this make sense to me? And so it doesn't have to
Yeah,
be very rigid.
being a bit of a theologian or a theologian about things like religion and
Yes.
readings and studies and all this stuff.
Yes.
Instead of being, devout Catholic or whatever it is, or Hindu or whatever what was it? Everyone's got a god to kill for. They just have different names.
Yeah.
You know what I mean? Like, yeah.
Exactly.
So, um, back on the therapeutic talk.
Yeah.
What do clients usually resist in therapy? And what is that, like a healing gold mine of sorts? Like their
Mm.
resistance might be in turn be the thing that's going to heal them?
Yeah, that's a good question. I think resistance is powerful in the sense that it's giving us some insight into where that exile part doesn't want to show up, where it doesn't want to go, right? It's a scary place, and the system is just not ready to go there. Part of also trauma work is, again, we're respecting the system's boundaries. So if it's like I'm really not ready to go there, maybe it doesn't quite trust the therapeutic process or myself just yet. So we have to also, it's a very delicate kind of balance or dance around how much do we push versus, just taking a step back and thinking, okay, you know what, we're going to put this on hold right now.
Yeah, the back burner.
Well, on the back burner for now, right? But it doesn't mean that we're letting go of that. It just means maybe we have to um, kind of go around that a little bit and ask questions around. Maybe there's protective mechanisms that, are defending the system and don't want us to quite get to that exiled or scary or vulnerable part just yet.
Absolutely.
There's also another thing I love to do. It's the empty chair technique. And this is part of emotion focused therapy. Gestalt also does it as well, and this is where we connect with people that, let's say, we have unfinished business with. I really like EFT because I don't use a kind of structured approach with EFT. It could be something that we're doing before implementing something like EMDR, which is much more structured. And so with EFT, if someone's talking about a relationship, oftentimes it's, with a loved one, the family, the most complicated relationships. So I might say, okay, you know what? Why don't we bring dad to the chair, or bring mom to the chair? That's where I noticed there could be a lot of resistance. So a person right then there'd be like, they're confronted with this person that brings up so much and can overwhelm the nervous system.
What an amazing technique.
It's a very cool one. Yeah. Yeah. But even with that, it can be so difficult because it's like, I don't know what to say. And you kind of notice a bit of resistance. And so I'm guiding the process. And so to kind of help, bring out whatever it is that person needs to say that person. It's also not like a one and done conversation. This happens over several sessions. But that's where I find a lot of resistance happen because that's where you're literally like imagining a person that's maybe brought up a lot of pain in you sitting right in front of you, and that can feel so paralyzing.
Yeah, what do you say to your ex who died or whatever? Let's
Yeah.
bring them into the room, or somebody that triggers or trauma or even glimmers you. So let's invite, Wayne Gretzky into the room and see what we have to say to him, something like that. But
Totally.
so yeah, that's pretty amazing. I got the empty chair technique. I'm going to use that alone. Just gonna picture being around someone that has either done a number on me or has been very kind to me, and see how that changes the gears, really, isn't it? Isn't that how empty
Yeah.
chairs should work?
Yeah, I mean, I would say, proceed with caution though if you're doing that on your own and you want to invite someone that, you have a pretty complicated history with, because I feel like that can bring up a lot of our own trauma, and then we're like, how do I navigate that and
Yeah. You
support?
trigger, you end up self-sabotaging
Yeah,
yourself. Yeah,
exactly.
for sure.
Yeah.
What are the moments, Alex, where you think this is why I do this?
Oh yeah, that's a good question. I i think over
Do you
time,
get that like often enough? Like,
yeah, it's so, I think that this, I find this kind of career, it's just so unique in the sense that it's like the only career that I can actually think of where you're using so much of yourself in the process. And so as much as you're there for the client, it's like, using that relational approach, I can't separate myself, my feelings, my opinions, whatever, this relationship, the counter transference, the transference, from the actual therapeutic process. And so it used to really be this kind of mind game where it'd be like, I thought that was a good session. How did they feel about that? Right. And then was
yeah,
that something that,
you kind of ruminate.
and then kind of ruminating on that. It's like, oh, could I have done something better? Maybe that reaction that they gave me wasn't a good one. But now I think what really gives me, and maybe this is more of like a redefined sense of meaning, what gives me a lot of pleasure in the work that I do is when I see someone opening up in a way that maybe previously they haven't. And so that can take several forms. It could be like, it's not them saying, oh my God, this is amazing. It could be, they like break down, or maybe they shared a really, really vulnerable piece of information with me. Like those little moments where I feel so connected to a person because I see how they ultimately trust me, that just feels, it's like invigorating for me. I'm like, wow, I'm so glad that we,
It's working.
yeah, it's working. Like we feel there's a sense of connection here, and it's quite deep.
Very true. And let's add something else to that. Like when you say this is why I do this, there's a connection. You've it's working. What are some misconceptions about that process?
Yeah. Yeah. About like the therapeutic process.
Yeah, let's see. Like what what doesn't work?
Yes. Yeah. Well, that's the piece, right? Like it's a risky business in that there's no guarantee. We have these evidence-based, approaches which, we've researched, and we can say, hey, there's a set amount of people who have with these kind of symptoms that have found, a lot of positive results from this technique, but that doesn't necessarily mean that everyone's going to feel that.
Yeah,
EMDR.
you can't put it all across the board on everybody. Like, yeah, certain things work differently for certain people, for sure.
Exactly. And I think, when you're talking about the buzzword of trauma, a big buzzword is EMDR. And I think a lot of people have this idea of what they think EMDR is, or maybe they talk to someone who's like, it was amazing. And then they come, and EMDR is very intensive trauma work. And so it's not like you just feel better after it can take, for some people, you can feel better after a few sessions. For some people, it could take months, if not years, reprocessing some events. And again, it's a very painful process. And
Yeah,
so people might try it out for like 2 sessions and they're like, okay, I'm done, right? Or my insurance has run out. And so it's
that's
almost like,
right.
yeah, there's those limits. And it's like, well, we haven't really gone to the other side of the healing, or maybe people aren't as prepared as they thought they were to do this kind of work.
Well, it's like working out or any kind of really like intensive work on yourself. It's not going to just be there the first time.
No.
You're not going to go into EMDR you shouldn't go into EMDR thinking that you're going to only have one session.
Yeah.
I mean,
Yeah.
it's like seeing any type of therapist, like a physiotherapist, a chiropractor, massage therapy. Generally, that doesn't like one time isn't going to solve the riddle or the equation or the solution.
Yeah. That's
Yeah.
it. Yeah. And it could be maybe you feel better after one session, but that's not fundamental, right? Like it's something that you need to keep coming, especially when it comes to like healing from trauma wounds, right? Like it's something that takes, again, you might feel a little bit lighter after saying, you might not, you might actually feel heavier, but it's
Yeah.
being able to really go through the process and complete it. That's where I found people have benefited the most from that.
And yeah, and to keep it going and have it be part of your life as therapy, whether you can come up with the money for every session, that sometimes is an issue for people. But I would say, if you have enough money for that fifth of bourbon, every month. Like, why wouldn't you put something better into your system than that? And that's kind of how I work. I kind of judge it. Is this worth my time and effort?
Yeah.
And if it is, then I'm going to continue with it and try and make do of it with whatever I can, muster.
Yeah.
I went through a period of severe burnout last year but it was only brief. Uh, this is a new topic. We're going to discuss burnout for about the next couple minutes, and we're almost through. But yeah, we tend to, Alex, we tend to make little bite-sized pieces of these little interviews, and what you've said today has really will definitely really help other people. Where do people on the edge of burnout even start? Where do we begin if we're almost there and we realize, hey, I'm not going to wait until I completely crash land. I'm gonna get some help for it. Where do we begin with something as serious as burnout?
Oh, yeah, that's a big one. I think identifying to what the source is of burnout, it's kind of one of those things. I remember working in corporate where it's like, they there's that kind of, they feed you that, like, that rhetoric of, we really care about your mental health, but I'm still going to be, expecting you to be working past 5 p.m., maybe evenings and weekends, and then giving you the same level of work, right? But here you go, here's a meditative lunchtime thing that you can do to help heal that. So it's like, okay, well, maybe it's not so much about trying to, stack coping tools upon coping tools and hoping that that fixes the issue. It's, where is this coming from? Like, are you noticing that, maybe what you're putting so much time and effort into is actually maybe not the whole story? Maybe that's not fulfilling you in the ways that you need to. It could be a part of what fulfills you, but maybe there's something else that you need to add that this thing isn't really giving you, right? It's like, how do I fill all these different buckets rather than, trying to fill that one bucket and hoping that that's going to give me that sense of fulfillment. We recently did a podcast about the differences between high achieving and overachieving as well. So that's the other piece, because that can be so connected to burnout. The difference is that high achieving,
Yeah, absolutely. Being like completely fully functional to a point where you're on the edge of burnout all the time. Like,
exactly, yes. Yeah, and that's oftentimes driven by maybe a sense of perfectionism, right? Like, if you're always feeling burnt out, maybe, the overachieving part is telling you can't take a break, keep going, keep pushing because it's never good enough. That can be fueled by shame, right? And so if I constantly think I'm not good enough, I have to keep striving to hopefully get that validation. High achieving, you might be able to set those boundaries a little bit more easily. You might be saying, hey, you know what? I have these high expectations of self. I'm going to do what I can, and whatever I can't do, I'm able to leave that to tomorrow, or it's not something that I have to keep pushing myself today to do, right? And so I think that could be another thing too with burnout. Oftentimes people don't really realize it until it's too late, but it's been something that's been building up. It didn't just happen, right? And so maybe we've been kind of ignoring some of those bodily cues leading up to that point, right? Because maybe
yeah,
we're
the
like,
physiological aspects.
that's it. Yeah, the physiological aspects of it, the parts of the body that are already telling you, hey, you know what, maybe take a break. No, I can do it. Just keep going. Just keep going. And then you get to the point, it's like, oh my God, I hate what I'm doing. I'm so tired. I'm angry all the time. I'm irritable. Like, and that's the point where it's like, okay, now I need to go on medical leave, right? And so it's oftentimes we wait until we push the body to its like max capacity for us to finally do something about it.
That's some really good advice. I mean, like, let your mind rest, be at ease with yourself, peace of mind, inner peace, being okay with, not being perfect. And yeah, very good advice for the physical body, for the mental body, for the spiritual body to go through is the fact that when your body's giving you warning signs, recognize them, write them down, go visit Canzonieri and see what she has to say, or watch Snackable Mental Health for a little while and see if you can glean anything from the stuff that I say or the stuff that my guests are preaching, not really preaching, but
Yeah.
you know what I mean. What's some mental health advice that sticks, Alex?
Oh, that's a
That
good
might
one.
be a big one.
Yeah, what sticks? Okay, maybe some advice that people have said really resonated with them is the idea. This is a big one in DBT. I like DBT because there's a strong mindfulness component to it. DBT is
What
very kind of like
what's
DBT,
what?
dialectical behavior therapy.
Oh, there we go.
So with DBT, it's very technique based, and people like that. It uses a lot of acronyms, so it's easy to remember. But one thing I really like about DBT, again, there's these other concepts, and they're kind of connected to Buddhism in a way. There's the radical acceptance piece. I think this also takes some pressure off of people. When you do not have control over a situation, we can go into victim narrative, and that perpetuates the distress and the suffering that we feel in that situation rather than constantly trying to exert control. It's not about not trying to change the situation, right? You can try to change the situation, but when you realize, hey, there's nothing I can do here, it's accepting the situation as this is what it is, not because, life hates you or, you're unique in some way or there's some kind of karma thing happening where it's coming back to bite you. You got a life threatening illness. And you know what? It really sucks, but this is the cards that I've been dealt with, right? So there's something about that that can feel kind of like, okay, I'm kind of like it's lifting this sense of I need to do more in order to fix this issue.
Wow.
Yeah, and I find that's it's easier said than done, but I think it's actually quite empowering because when we're able to also let go of that piece of the control and radically accept, it's not about losing or we're just kind of waving the white flag. It's more like no, I'm actually now taking like it's that idea that when I let go of control, I actually have more control because it's not something
Absolutely.
occupying my mind. And then another thing that I use a lot is the idea of dialectics. And so when people are like, yeah, but this is happening and it's, very black or white, it's like that can be happening and so can this, right? So two things can coexist. It doesn't have to be either or. And I think that also that's quite applicable in relationships too. This person's always this. We have this whole narrative about the whole person. Maybe all those things are true and that's how it feels. And maybe, they're also hurting and they love you and there's this compassion that they feel for you. And so when they say these things, it comes from that place of care, right? Like it's again this other reality that can also exist with ours.
Yeah, like I mean, hearing some bad news. This week I heard that a very, very close friend of mine who lives far away, but was what had been battling cancer for more than a year. And it was something that even when we talked, he wouldn't bring it up.
Mm.
And I didn't know. And drop everything. Oh my God, this friend of mine has a severe form of blood of a weird unique blood cancer, and I was like, you know what? I can stop what I'm doing right now. It's not that important what's going on in my life right now as far as it's things tend to when a big health scare comes your way, you tend to reevaluate things, Alex. You tend to go into, you're like, wow, okay, so most of the things that I'm doing right now are not nearly as important as my focus for this friend who is not
Mm.
going to be around in another 6 months. And I'm a student right now, but a late in life student. But I was like, you know what, my schoolwork really can take a break for the next couple of days for me to kind of digest this crazy life of ours where we can lose someone in an instant, and that's the most important thing, is to focus on that right now as opposed to my silly hopes and dreams of becoming a screenwriter. That you know what I mean? Like that's it was just so I was made so aware of how serious this was and that it mattered more than, you know, me writing an essay on drama writing or whatever, or on a, yeah. So awesome talk. Yeah.
Well, I'm sorry
um,
to hear about your friend. And also, you're right. I can imagine like it puts things in perspective right now, right? Like, not to
that's
say
a
that,
big word that I missed there. Perspective, for sure. Yeah.
yeah, yeah, your school is important, and your friends like that's. It sounds like it's changed the order of things for you. They're both important, though.
Yes, Alex. A severe health scare is something kind of to snap you out of your life and get you into a more. I want to bring up Buddhism again, but get you into the feeling that you're in a different situation now, but like it's what's important and what isn't, or what takes triage over something that does not really, yeah, absolutely. So, a wonderful talk with you. And it seemed to have flown by.
It did. It really was looking at the time. I was like, oh my God, this,
Yeah.
this went like
So,
passion.
you know what? Maybe we can do this again in 6 months.
I love that. Yeah.
And yeah, and it should be up on the YouTube by next week. And we're gonna chop it apart and come up with your best lines and whatever jokes I have.
Awesome.
And yeah, let's digest this all over the next couple of days, and we'll see where we are. And thank you so much, Alex Canzonieri,
Good. Yeah,
for
I get to
coming
meet.
on the show from GreenPath out of Toronto at Etobicoke, right?
Yes.
Okay, so anybody that's in that area that is a listener that would like some remarkably new ways of looking at things in your therapy or whatever type of diagnosis you might have, or if you're afflicted by trauma in any way, I would suggest take it to Alex. And thanks for the free therapy.
Oh,
All
my pleasure. Lovely
right.
chatting. Thank you again.
All right. Take care.
You too. Bye.